Health info. Making sense of health. Today, let's talk about diabetes mellitus and all you need to know about this disease. Diabetes mellitus is a metabolic disease that occurs when our body fails to metabolize glucose in our bloodstream. A metabolic disease is defined as any of the diseases or disorders that disrupt normal metabolism, the process of converting food to energy on a cellular level. There are two major types of diabetes: Type 1 diabetes and Type 2 diabetes. Less common forms of diabetes may include gestational diabetes, monogenic diabetes, neonatal diabetes, Wolfram syndrome, and Alström syndrome. So the question is, who is at risk of developing diabetes? The people who are at a higher risk of developing diabetes usually have a positive family history, are above the age of 35 years, usually have a BMI above 25 kilograms per meter square, hypertension, exhibit sedentary lifestyle, have a history of recent weight gain, or had experienced gestational diabetes. Type 2 diabetes in early stages is asymptomatic, which means that the patient does not experience anything out of the usual in how they feel or carry out their activities. This is why it is important to know about the early signs and symptoms to identify the disease and control it as soon as possible to prevent any complications. Some of the common signs and symptoms of diabetes are increased thirst, slow healing of cuts, frequent urination, constant hunger, blurred vision, unexplained weight loss in type 1 diabetes patients, or unexpected weight gain in type 2 diabetes, headaches, and tingling or numbness in hands and feet. If these signs and symptoms are overlooked, it can cause severe medical complications. Sadly, patients with diabetes are at a risk of developing heart problems, neuropathy, loss of vision, kidney damage, depression, dementia, and slow wound healing. Luckily, scientists and doctors have found many treatments and ways through which diabetes can be kept in control, which is also called diabetes management. Type 1 diabetes is treated with insulin, as the patient's body is unable to make any insulin. In type 2 diabetes patients, the best approach to counter the disease is through lifestyle modification, which includes diet and exercise, along with medications. In some cases, patients with type 2 diabetes may be prescribed insulin. How can you prevent diabetes or slow down its progression if you're diagnosed as a pre-diabetic? The type of food you eat plays an important role in changing the glucose levels in your blood. Avoid eating too much carbohydrates. Cut out saturated and trans fatty acids from your diet. Eat fruits, vegetables, and whole grains. And eat frequent small meal portions. It's important to understand that exercise plays a crucial role in your diabetes management. It is recommended to have at least 150 minutes of aerobic exercise per week. Some examples are cycling or walking. Your physician may recommend medications to help manage and control your diabetes better. Keep watching our videos to learn more about diabetes. If you like our videos and want to learn more about a certain topic, please leave a comment below. Subscribe and share to help others.